At the highly infectious disease unit at Kenyatta National Hospital, all patients here are confirmed COVID-19 positive. Access here is highly restricted and entrance-exit is under lock and key round the clock. The ominous red directional sign leads us to where critically ill patients receive crucial support. Infectious disease physicians and nurses only enter the wards when it is absolutely necessary when doing rounds and checking on the patients. We're in the company of Dr. Foeb Juma, an infectious disease specialist, Dan Were, the head nurse, and my colleagues Ben Kirui and cameraman Steve Kiprop. The personal protective equipment, our last line of defense in these wards, which are designated high risk because of those admitted here. This facility attends to patients who are between moderate and severely ill. Doctors here tell us that they largely rely on antibiotics and supplementary oxygen to stabilize the patients. Sela, not her real name, has been in the hospital for more than 10 days now. She is elderly and has a pre-existing health condition, high blood pressure, and added risk to her COVID-19 infection, and the blood pressure has got worse since she contracted COVID-19.
Sasa hiyo nimeisha kabisa. I am na hema kabisa. Niki step 2, it is an effort. Ukipinduka it is an effort. Yani unakuwa na blackout.
Coming to the red zone for Sela was a frightening experience.
It is real. It is there. And it has a very bad feeling. Yani it ni mbaya. Yani hiyo experience sijawahi kuwa mgonjwa hivi.
At first, not even her family believed she was fighting COVID-19.
Wana fever, coughing. Sasa najua ni binadamu, nikaenda kwa chemist. Nikanunua antibiotic. Nikameza, zilikuwa tembe 3. Nothing. My sister ula nakana akaniambia hapana, hii ni malaria. Akaenda kaniletea dawa ya malaria, nothing. Nikafika mahali nikamwambia mimi I can't taste, I can't smell, I can't eat anything, I don't want to see food.
What started as a fever and cough quickly mutated to severe fatigue and shortness of breath. The symptoms were all pointing in the direction of the highly infectious disease.
And then niko na kunywa ndimu, tangawizi na garlic kwa nyumba. So wakati walinipea madawa kaniambia don't take anything acidic. Nikaenda nikakaa. That was now on a Wednesday. Nikakaa nikameza hizo madawa zao. Thursday, Friday, Saturday nikaona sasa siwezi. Imezidi.
Sela tried to get help at the Kenyatta University Referral Hospital, but there was no room owing to the surging numbers of patients. She was turned away.
You know, I didn't even know where to go. So I went to KU. Niweze kupimwa. Wakati nifika huko wakasema hao wanapokea wagonjwa. Wale wako na COVID, sio wale wanapimwa. Nikarudi. I was feeling so bad.
It is at MP Shah that Sela was finally told she had symptoms that pointed at COVID-19. Sela is not sure where she contracted the virus. The symptoms, however, started showing after she attended a burial in Siaya County a fortnight ago.
Wakati tuliambiwa people of my age stay at home, I really did stay at home. Wakati tulipata hiyo matanga ndio toka tukakutana, so I never imagined I could get it.
At the second wing of the hospital is another patient who requests that we do not show his face. Patient 2, as we will refer to him, manifested severe chest pains and difficulty in breathing and was admitted here on Monday.
Nilipimwa COVID-19 last week. Alafu jana nikapokea majibu kwamba mimi niko positive. Kohozi kimeshika kifua na sore throat. So nina struggle kupumua.
This is but a snapshot of the brutal reality across hospitals right now. Patients fighting to shake off the virus, with patient 2 admitting that he did not adhere to safety protocols, saying that may be reason he is here today, ill but much better after treatment.
Hii COVID nilipata kupitia tumekuwa na kazi mingi, wazungu na watu kutoka maeneo tofauti, na si kuzingatia kuvaa mask kama kufanya social distancing, na si kuzingatia pia kufanya hand washing. Kwa hivyo nikaanza kuhisi mwili tofauti katika mwili.
Is now fully aware of the afflictions of COVID-19 and is on the front line urging his family, friends and Kenyans to observe utmost safety to safeguard themselves and their loved ones. He tells us every breath he takes is akin to a miracle, and the tireless work of the doctors and nurses here on the front line doing all they can to save lives from the pandemic.
Watu wote, marafiki, wazazi wangu nyumbani, kila mahali, kwamba waweze kujichunga, wafaye mask na wakeep distance na wafanye hand washing, na kwa hiyo njia naamini kwamba Mungu atakinga population kubwa ya Kenya from COVID-19.
On bed 29, we meet James Gitui Juma, a 38-year-old small-scale trader plying Nairobi and Nyeri County. He is the only patient who has given us permission to reveal his face and full identity. In his words, COVID-19 is here and ravaging real people.
Patiwa nini? Oxygen. Sasa hapo ndio nilipata nguvu kiasi, alafu na drip. Niliwekwa drip kama 6 hivi. Sasa ndio nikaregain kiasi.
James, a father of 2, seems to have recovered his strength, but doctors here are still monitoring him, awaiting a retest.
Nimeona changes. Juu nilikuja huku nilikuwa nimewekwa hewa. Sikuwa napumua vizuri, lakini venye nilikuja hapa nikawekwa hewa, nikaanza kupumua vizuri. Na saa hizi niko na improvement kubwa, hata sikuwa nakula.
The 3 patients are now stabilized and able to communicate, but they are still under the care of Dr. Juma and her colleagues who are on standby for any signs of distress. Downstairs, however, is a section where those with severe illness are treated. The beds are filled to capacity. Patients here are in dire need of oxygen. Most patients here have severe conditions and must be monitored closely.
10 to 15, they are very sick. Yeah. The others are just moderate and mild.
Doctors tell us patients with under 90% of oxygen in their system need supplemental oxygen.
What you see on the wall is called a flow meter. So it gives you the flow rate per minute, the liters per minute of oxygen. Yeah, so it's variable depending on the person. But for the people who are severely ill, those ones require anything from 10 to 15 liters per minute of oxygen.
Challenge is that people tend to come with severe cases and moderate. There are many who are severely ill right now, and when they are severely ill, it means most of them would require total nursing care, whereby everything is done for the patient.
After 3 hours in the red zone, we learned that fighting a severe strain of COVID-19 is an exhausting and draining process, especially for a patient struggling to stay alive. For the doctors, nurses and cleaners here, this is the environment they work in on a daily basis. Tomorrow on part 2 of Tales from the Frontline, we give you doctors' accounts of this war against COVID-19 pandemic and the only available treatment regimes for those infected. Elfas Lagat, Citizen TV, Nairobi.